Thanks, Premier. So, as we indicated yesterday in the Parliament, the government's established, based on the bitter lessons of 2020, a series of streamed approaches to how we deal with presentations in hospital of the coronavirus. Obviously, before then, what we have is a COVID positive pathway in the community where, again, our hardworking nurses, clinicians, GPs, community health providers are providing active support to people in the community, in isolation at home when they are COVID positive. Engaging with them every day, keeping an eye on them that way. And those nurses, those clinical staff are doing a fantastic job as well. But Delta is a nastier variant of the coronavirus, and it does more damage and it puts more people more unwell quicker. And as a result, what we've established based on those lessons and international experience is an initial 4 streamed hospitals rather, that focus around specialised IPC control, ventilation, staffing arrangements to manage the adults. In addition to that, we've set up paediatric specialist units at 2 other hospitals and specialist women and maternity support in 2 others. And that's all on the basis of expecting to grow that should cases increase across not just those hospitals, but a range of others. And it's almost the iron-like maths logic of cases today in 10 to 12 to 14 days, some will need further levels of hospital care. So as we see more cases, we have to prepare for that into the future. And as the Premier said, whether it's beds, whether it's locations, whether it's consumables, whether it's PPE, whether it's equipment, all of that is critical. But ICU nurses and specialists do not grow on trees. The thing that we can do most importantly to support them is to follow the public health rules, is to get ourselves vaccinated as soon as we possibly can. Those frontline ICU staff last year in full PPE, in N95 masks for 12-hour shifts, for double shifts, they flogged themselves senseless for the Victorian people. The least we can all do to back them is to make sure that we take those public health measures, we follow the rules and we get vaccinated. That way we will support them. We've got better plans, we've got better equipment, we've got more experienced people with international experience showing us how we can get through these systems. But the best way we can get through that is to keep the cases low by getting vaccinated and following the public health rules.